Thank you very much for this recognition, and thank you very much, Dr. Barrow, for your very kind words. And thank you, Caitlin, for reminding Ian that this was not a post. Ian has way too much dirt on me to be allowed to teach lots of that indiscriminately. So I was very honored to be nominated for this award, and I was both shocked and flattered when I found out that I had received it. I would very much like to thank my colleagues and supporters who nominated me for this award, and particularly Dr. Jen Tang, who I think emailed everybody I know. I would also like to thank Ian for not pointing out that I did text him about 3 days ago to make sure that I was wearing what I was supposed to wear. Winning an award like this is certainly very motivating. As with most things in life, I certainly did not get here alone. I work with great people, and nothing I have been able to accomplish would have been possible without their help and support. Although there are way too many people to mention individually, there are a few groups that I think are worth mentioning. The clinical teams I work with in the emergency department and in the PEDS department, as well as all the consulting services that have the privilege of getting here for me at 3 o'clock in the morning. I'm sure we're all very happy about that. Also, my resident groups. So all the residents I work with every day, and in particular, the residents from the MacEmerge program that I definitely work with every day. They are all way smarter than I am, and I think it's a great motivator to stay up to date, if for no other reason than to keep up with that. They also bring up some really great ideas about things that we can do to change the program, to change the way we provide care to patients, and I think that the future is very bright when we look at the work they're doing. I would also like to thank all the administrative teams I've worked with over the past few years at the hospital, the university, and in the emergency medicine program at MAC. Administrators often get a really bad rap, but I can say without reservation that they work really, really hard to make sure that the clinical and educational teams have everything that they need to do their job. And of course, I'd like to thank my family who have supported me through everything, even some of the crazy things that they think I'm doing. I think the past 2 years have, without a doubt, shown that healthcare is definitely a team sport and that no one person can do it alone. I have been incredibly privileged to have many people who have supported me, opened doors for me, including some people in this room. And I hope I can use my privilege to help and support others in their aspirations, and particularly those who have historically been marginalized. No remarks by me would be complete without a Star Wars or Harry Potter reference, and I noticed that some of the meeting materials have Harry Potter references in them as well. So I will close by saying that I hope I continue to live by Dumbledore's words, that help will always be given at all points. Thank you again for this recognition.